K is for knowledge. Now, the level of knowledge being tested in the MSRA is that expected of a junior doctor at FY2 level. Now, the clinical questions, remember, are going to be covering these curriculum areas, but each individual question may relate to one or more of these question types. So some will be testing knowledge about investigations. What might be the appropriate test to do for a patient that presents with these symptoms? Or a patient who is suddenly become unwell on the ward and you're worried about X, Y, or Z. Some will be about disease factors. Patients come worried about their risk of getting this disease. Which of these are important risk factors for this particular illness? Some will be about making a diagnosis. So patient presents with these symptoms, these are the exam findings, you might have some blood results as well. What's the single most likely diagnosis? Some will be about emergency care, acute severe asthma, sudden collapse, life support, anaphylaxis, suspected meningitis, prescribing. So there'll be questions testing knowledge of appropriate drugs or prescriptions for common and important conditions. But there can also be questions on management that's not to do with prescribing. Who to refer urgently under a suspected cancer guideline, who to refer non-urgently, who we need to do a certain test for, who can just reassure because what they've got is a self-limiting illness, and so on. So remember, you need to both cover the curriculum and practice questions testing these different question types.